Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery, and all I perform is cosmetic or aesthetic plastic surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and I have been performing fat transfer or fat injections for 15 years now. I think it's a fantastic procedure. A very common question that patients ask is, how long will the fat transfer or these fat injections last? And where and how is it different in different parts of the body? The first thing to understand about fat transfer is it's completely technique dependent, which means it completely depends upon who's doing it. Having done it for over 15 years, I think that I have quite an experience, and probably more than just about anybody in the Scottsdale Paradise Valley area. Specifically, I have learned over time a very precise technique, and one that I use daily. I think I use fat transfer probably 4 out of the 5 days of a week in my practice. I think it's very important to handle the fat very delicately. The reason being is that we're not asking that fat to be a filler, we're asking it to be a transplant. So we want that fat to get its own blood supply. So how does it do that? Well, first of all, from the donor site, when I take the fat through very small cannulas, which means the diameter of the cannula is very small, and I also take it with a syringe which has very, very low pressure. I think that adds very little trauma to the fat cells, and then after that they are purified or centrifuged in a very atraumatic fashion. I think that also lends itself to increased graft survival. After that, when I have the purified fat, I will inject it through incredibly small cannulas. The most common cannulas that I use, at least in the face, are less than 1 millimeter in diameter. So they're either 0.7 or 0.9 millimeters in diameter. That fat is put in atraumatically, so it's put in very delicately with very little pressure, and it's put in different levels. So that ensures increased survival in my fat. I would say beneath the eyes, my fat almost lasts completely. So it's very uncommon for me to have to re-inject beneath the eyes. Other areas where I inject would be the nasolabial folds, around the mouth and the lips, the jawline, or what we call the geniomandibular groove, and the temples. The rest of the face, again, I think that it's very uncommon for me to have to re-inject fat again, so that longevity is close to complete. In areas where there's a lot of facial motion, that is the lips and the corners of the mouth, I think that generally about 50 or 60% of my fat lasts, so it's not uncommon for me to go ahead and re-inject in the office under local anesthesia. Areas of the face that tend to be unpredictable would be the temples, and for that reason, either quite commonly I'll have to re-inject, or we'll put a soft tissue filler in if we're not happy with the fat transfer. The reason being for that is that the planes or the tissue beneath the skin where the fat is injected is not predictable, so the fat longevity is not predictable. So across the board, I'd say that beneath the eyes, my fat lasts almost completely. In the nasolabial folds, along the jawline, again, almost completely. In the lips and the corners of the mouth, quite often I have to re-inject again. In the temples, occasionally I have to re-inject again. Now, what other areas of the body do I inject fat? It is very common for me to do a Brazilian butt lift. So that is fat injections to the rear end to increase projection, to increase perkiness and fullness. I will take that fat from areas of the body where I'm performing liposuction and then purify that, and again, re-inject that delicately. I'd say in my hands, I have not had to re-inject fat for volume. Occasionally I've had to re-inject it for a little bit of contour asymmetry, but generally my fat in terms of volume lasts anywhere between 50 and 80%, but enough that I will overfill, and consequently I don't need to go back and fill again. Other areas where I inject would be the thighs to give people a little bit more feminine contour. Again, I generally don't have to go back and re-inject again. Other areas where I inject in men would be in the chest to increase their pectoralis projection in lieu of pectoralis implants. Again, I have not had to go back and re-inject the chest. Now, fat injections for breast augmentation is a different situation. In patients that I will increase volume, maybe going from an A to a B cup or a B cup to a C cup, I have not had to go back and re-inject fat. I find that my fat is long-lasting, but I will overfill to take up or to take in consideration some of that reabsorption. So I'd say in those situations, probably anywhere between 60 and 80% of my fat will last. In patients that want bigger augmentation, so going from 2 cups, like an A to a C, generally they will need 2 sessions of fat transfer. And in the certain patients, I will perform that. In other patients, I will go ahead and just recommend a breast augmentation with an implant, either silicone or saline. So overall, I think the most important deciding factor with fat longevity is who is performing it, what their technique is like. Discuss that with them. Discuss how long they've been performing fat transfer. Ask how it is done. Ask what the policy is if, in fact, there needs to be re-injection. But this is a very hot topic now. I think finally people are jumping on board. But buyer beware. Make sure that your plastic surgeon is very, very experienced in fat transfer. Make sure that you see before and afters. I think when someone goes on the internet, they should look and see if the fat is included in the facelifts, if you will, or blepharoplasties. Almost always that is performed at the same time as my facial rejuvenative surgery. A very common procedure for me is a Brazilian butt lift. Not many doctors do it, I think, well. So all in all, go in, see a plastic surgeon that performs a lot of fat transfer, and find out what your options are and what the policies are for re-injection. Thank you.